Good afternoon, everyone. I'd like to call on our chaplain, John Gerhardt, for the invocation.
Thank you, Chairman Carter. Would you rise with me, please? And would you bow your heads as we pray? Lord our God, we give you thanks this day for the blessings of living in South Florida in the winter. We are grateful for the cheerful sunshine, the bright blue skies, and the refreshing cool air. But we realize that many in our nation are currently enduring the hardships of a bitterly cold and harsh winter, and we pray for them. And likewise, many of us who have gathered this afternoon are very grateful for the blessings of strength and good health. But we ask you to remind us, our Lord, that mere steps away from this room are multitudes who have found themselves in a difficult winter season of their lives. As they endure the hardship and the suffering of the storms that assail their bodies and their spirits, they have come to us for aid. Would you bless our efforts to care for these, our neighbors? Grant healing and comfort to our patients according to your will. Bless our staff with strength and compassion, and guide this hospital board and our leadership as they serve. These things together we pray. Amen.
Amen. Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to call to order the meeting of the Sarasota County Public Hospital Board. Start with approval of orders of the day.
Mr. Chairman?
Hello?
Yes, I'd like to change the orders of the day to reflect action on recommendations from the Investment Committee this afternoon. I propose a motion. I move a change to the orders of the day to replace items, what's that, 14CB, to read approval of the investment managers for the investment areas of public bank loans, emerging market debt, master limited partnerships, private core real estate, hedge funds, U.S. large and small cap equities, international large and small cap equities, emerging market equities, and fixed income.
Second.
We have a motion and a second. All those in favor, please indicate by saying yes.
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 Opposed? Motion carries.
And I move approval of the orders of the day as amended.
Approved and seconded. Any corrections, comments? If not, minutes are approved. Thank you. Now we have approval of the minutes of the meeting of January 21st.
So moved.
Oh.
Second.
Let me read the announcement. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Now we'll have approval of the minutes of January 21st.
So moved.
Motion and a second. Any corrections? If not, minutes stand as written. I'd like to call on our Chief of Staff, Dr. Cindy Von Waldner, to introduce our speaker, please.
Thank you, Mr. Carter. It is with great pleasure that I introduce this month's physician speaker, Dr. Mauricio Concha. After attending medical school in Columbia, Dr. Concha obtained a Master's of Health Science in Epidemiology from Johns Hopkins before completing his residency in neurology and fellowships in both dementia and cerebral vascular disease from the University of Miami. After spending 4 years as an assistant professor of neurology at Miami, he moved to Sarasota, eventually joining Intercoastal Medical Group in 2003. At Sarasota Memorial Hospital, he has served as the medical director of the stroke program since 2003 and chairman of the neuroscience department since 2012. Extensively published, Dr. Concha continues to be involved in ongoing NIH clinical trials here at SMH, specifically evaluating different modalities in the treatment and prevention of stroke. He tells me that his focus for 2014 is in establishing novel, creative methods to engage the community in weight loss and exercise programs for the prevention of strokes and other complications. With that, please give a warm welcome to Dr. Concha as he presents the stroke program update.
Thank you. So I'll try to be as succinct as possible, and it's not easy to summarize this many years of work and this complexity of a program. But before I move ahead, I want to recognize the fact that I'm here representing a large group of members of this hospital that have put forward their efforts to make sure that we win the battle, one battle at a time, of this devastating disease. The reason we do this is because stroke continues to be the leading cause of disability in our country. Now, putting it simply, there are two types of stroke. There's the hemorrhagic type, that is about 15 to 20% of all cases, and this is the result of a rupture of a blood vessel. And there is the ischemic type, that is due to an occlusion of a blood vessel, or an artery in this case. And those are about 85% of the cases. I'll be presenting data, even though we covered all types of strokes, I'll be presenting the data today that pertains to the 85%, that is to the ischemic strokes. And the reason is because there's been a major breakthrough in the field with a medication, a very powerful thrombolytic, or a clot-dissolving medication, that has been in the market since 1996, but has been very challenging to get people to use this medication because its window of opportunity to be used is very narrow. And it's also very challenging to recognize the signs and symptoms of someone that is having a stroke. However, studies have been very clear that if someone that is having an ischemic stroke is treated with this drug within 3 hours, their chances of leaving the hospital with minimal to no disability is 30% better than those that don't. And this has been sustained study after study. So here's what we have accomplished over the years. Before the program, we were using this drug in less than 1% of the ischemic strokes that were presenting to our doors. Since the program started, there's been a steady rise, and you can see that we're now within 10 to 14% year after year in the last 3 to 4 years. And this has been equivalent to the large, important stroke centers around the country. Just to put it in perspective, less than half of that, still less than 6% of Medicare members across the nation are receiving this drug. So we're doing far better than the average, the national average of Medicare members. Now, it's just not about giving the medication. It's about giving it right to the right patients. And so the big question is, are we harming or are we helping patients? And in this slide, you can see that we have treated more than 300 patients since the beginning of the program in 2004. Despite of that, our mortality remains within that is expected according to the literature, anywhere between 25 to 30%. And the complication rate is within the expected number of less than 6%. More importantly, over 2/3 of our patients end up going home or to an acute rehabilitation. So we are well within the expected numbers that are published in the literature. Now, we need to take it a step further. And again, it's just not about giving TPA, but giving it very fast. And the reason is because the studies have also been very clear, as you can see here, that the earlier you use this medication, that chance of improving increases. So if you were to use this medication within an hour and a half after the onset of the symptoms, then the chance of improving or coming out of the hospital with a good outcome is nearly threefold compared to those that don't receive the medication. And as time goes by, then that improvement starts declining. And so you can see that it's only 1.5 times at 3 hours, and then you start losing the effectiveness of the drug about 4.5 hours out. So because of that, there's been a tremendous push to try to give this medication really fast. And so now the focus is on something called the door-to-needle time. And we want that to be at least 50% of the times, 50% of the patients to receive the drug within that 1 hour or golden hour. Now for that, we need a well-oiled team so that when the patient comes through, everything is well choreographed and the whole process runs smoothly so that from the moment the patient hits the door to the moment we deliver the medication, we can do that within less than 60 minutes. And this has taken a lot of effort from the team, but finally we are there. So you can see that in 2011 and 2012, despite of our attention to it and despite of trying to make changes, we were still with a median time of 90 minutes. But in 2013, we were able to bring that time down to an average for the year of 63 minutes. And I can tell you that for the last quarter, that time was under 60 minutes, was 57 minutes. Perhaps this is the most important slide that I would like to share with you today. And that is, in the light blue bars, what you can see is the proportion of patients that present to our institution with an ischemic stroke within 2 hours after the onset of the symptoms. And of those, how many received the drug? And in 2011, 76%, in 2012, 93%. And I can proudly say and show to you that in 2013, 100% of the patients received the drug. Now, on the darker blue bars, what you see is the proportion of patients that are treated with this drug under 60 minutes. And so we closed the year with 57% when we started at 7%. These are numbers that I feel proud about, and these are numbers that we can proudly share, and I find it very difficult, and I know for a fact that few institutions have achieved these numbers. So in essence, a comprehensive stroke center like ours provides expertise, comprehensive care, offers a wide spectrum of treatment options, optimizes care and minimizes complications, and at the end, improves outcomes. Here are some of the accomplishments of our program. We have been certified by JCAHO since 2005 for a total of 5 times. The last one was in December of 2013, and this was a certification that we received with no recommendations. We have been ACA certified as a comprehensive stroke center since 2006, and we have received the Gold Plus Achievement Award by the American Stroke Association due to the quality of our data and quality improvement measures. As our efforts to improve education, awareness, and knowledge of a stroke for the members of this hospital, as well as for the public, we started our annual Neuroscience Summit. I want to recognize the support of sponsors, including the foundation that has been key throughout our program. And today I want to express my special thanks to Dr. Arthur Ankowitz, president of the Stroke Foundation, who supported our first Neuroscience Summit in May of 2013, which was a success.
Let's take a picture.
Thank you.
Arthur, before you, can you, we're gonna Never mind.
Good afternoon. I'm Dr. Arthur Ankowitz, president of the Stroke Foundation, which was founded in 1967. It was founded because of people who are afraid of getting a stroke, people who want to take measures against stroke, and people who have had a stroke. We have had a long, tortuous journey on our path to stroke prevention. I want to congratulate Dr. Concha and the members of the board for encouraging research in that area. I'd like to point out the analogy between David and Goliath and stroke prevention. We in medicine are on the cusp of revolutionary developments. We have our means and methods to combat arteriosclerosis, hardening of the arteries, and the plaque within those arteries which cause heart attacks and strokes. The public has to be led. In our generation, my generation, has failed to uniformly follow that lead. We are engaged in research to enable us all to benefit of the prevention of most heart attacks and strokes. William Shakespeare said, "Not everyone is born to greatness. Some achieve it by birth, some achieve it by hard work, and others have greatness thrust upon them." I urge the members of the board to become great in opposing the devils of the Goliaths that prevent our development of stroke prevention programs. I thank you very much.
Now we'll have our Excel Award winner.
Our Excel recipient for the month of February 2014 is Suzanne Casey, an RN. You brought them again. Suzanne is an RN in labor and delivery. Suzanne is the Excel recipient for February 2014. She's been an employee of Sarasota Memorial since March of 1991. Admirable, wise, respected, calm, and composed are just a few words from physicians, co-workers, patients, and families that make up the nominations for this special and highly talented nurse. Here are a few comments. Suzanne started at SMH as an LPN in respiratory and transferred to antepartum postpartum. She went back to school and received her associate's and passed her RN licensure. She continued her professional development by completing her BSN at USF. She transferred into labor and delivery and has worked both day and night shifts. She has both national certification in inpatient OB and EFM. Suzanne has excelled in her job duties and is considered an expert on our unit. She is, hands down, one of the best critical thinkers in the department. She's a vital part of the L&D team. While working toward a nursing career, it's comforting and inspiring for me to have Suzanne as my preceptor, as she's a great role model. Not only is she an excellent healthcare professional, she's a genuinely caring soul. I feel fortunate to work with such an amazing woman. Suzanne has a way about her that's hard to put into words. She gives each and every one of her patients a piece of her heart, making them feel comfortable and cared for, as if they were the only woman to ever visit our unit. Her patient care goes above and beyond anything I've ever witnessed. Her ability to communicate with others, no matter who, is something to strive for. She is the nurse you would like to have on 24/7. She's always pleasant and caring, but even more, she's an astute assessor of any critical situation. She's able to anticipate what may be needed and to be prepared for any eventuality. I want her on my team. I'm always relieved when she's the nurse caring for my patient. I know then that my patient is in the best of hands and she'll be cared for optimally. For Nurses Week, she received a card from her leader that said, Thank you for your leadership and attention to detail. Your healthy perspective on what is truly important inspires others. I'm grateful that you're mindful of the finishing touches that make a good job a superior job. The character of a nurse is as important as the knowledge she possesses. I can honestly say I'm a better nurse, mother, and person due to the relationship I've had with Suzanne since I met her on the antepartum unit back in 1991. Suzanne always told me that patients remember the key moments in their lives: marriage, the births of their children, and the deaths of loved ones. She stressed that we can make this moment in their lives a memorable one, and she does. I feel fortunate to have her present at the birth of both of my children, and I know I will always remember Suzanne Casey. Usually I read a patient letter at the end of the meeting, as you know, but today I'd like to read this letter with Suzanne at my side. What are you laughing about? Give me your hand.
It's a long one, sorry.
It's a long one. I let her sit down in the management council when we read this because she was just so nervous and shaking and surprised, and her husband was there, and it was really a nice thing, yeah. We were first introduced to Suzanne Casey when we were admitted to Sarasota Memorial when my wife went into preterm labor. Suzanne, by the grace of God, was the nurse on duty. She was great all through the night, both as a nurse and a cheerleader and educator to us. My wife was only 22 weeks pregnant, and our doctor told us we had no chance for our daughter to survive. Suzanne never let us dwell on that throughout the night, and she kept telling my wife she could do it. I still remember when she left that morning, she said she would see us that night. We did make it another day, and Suzanne again was exceptional in all ways as a caregiver. Because the doctors were so sure our daughter was going to be born any minute, we stayed in a labor and delivery room for 5 days. Suzanne kept look over us the entire time and always came after her shift and before to check on that we were still there. After the 6th morning, we were transferred to an antepartum room. That should have been the end of Suzanne's time with us, but it was not. She came every day to check on us, and not just for a pop-in like our doctor, but to ask how we really were doing. She would answer questions and give us pep talks. Other nurses would comment that Suzanne would tell them to take good care of us. In all, my wife was able to make it 17 days before my daughter decided she could not wait another minute. When the code was called, it was just before 2 a.m., and even though she was not in our area, Suzanne was the second lady in the room. I'm not sure how she made it as fast as she did, but again, by the grace of God, she was right there by our side. She went into the delivery and she stood with me and talked me through every single thing they were doing with my wife, Leanne, and she talked me through what to expect when Gracie was born, as it was mayhem with a 24-week preemie coming into the world. I remember her telling me color and if she made a peep or not. It's still the scariest and best day of my life, and Suzanne was not just part of it, but some of my most vivid and poignant memories are all the kindness and care she showed us. When they determined that there was something they could do for Gracie, I was ushered into the NICU, and Suzanne was right there and talked me through each step the doctor was going through. I remember my daughter weighed only 1 pound, 5 ounces. She was so small that the concern was they may not get a PICC line started. I remember, after what seemed like an eternity, Suzanne exclaiming, "He got it." I was crying both because I was happy, but I think mostly because I was so scared. It was a life-changing event, not because it was the birth of my first and only child, but because it was all such a miracle. And again, my most vivid memories, which my wife did not get to experience, were shared with a lady for whom I have the most profound love and respect. I could not have asked for anyone, including parents, that I would rather have had by my side. Our story at SMH was just beginning as my daughter beat all the odds and through a heart surgery at All Children's and 3 laser eye surgeries at SMH, we lived in the NICU for 96 days. In almost all those days, unless she was off, Suzanne Casey visited with us, not as a nurse, but as a friend who again gave us pep talks on the bad days and shared in our joys on the good ones. My wife would stay all day in the NICU, and I would go home every night and read and just sit, usually until 2 in the morning, and most nights I would go in every night and read And around 2 in the morning, most nights, I would see Miss Suzanne, as I like to call her. It sounds crazy, I know, but just knowing she was in the hospital somewhere made us feel more at ease. We became so attached to her that we worried she might think we had gone mental. My wife lost her mother at an early age, and all of our family lives in the Carolinas, and Suzanne was as close to family as we had during the most important time in our life. After 96 days, we checked Gracie out of SMH weighing 4 pounds, 8 ounces. Suzanne was not there that day, but we kept in touch via phone, and she has never missed sending Gracie a birthday card. I also send Suzanne flowers every year on Gracie's birthday, and the number of roses reflect how many years Gracie is celebrating. It is my way of letting her know that what she did for us we will never forget, but more importantly, we remember often, and it makes us happy and thankful for the lady who was like a guardian angel for our family. We were lucky enough this past year to see Suzanne at Gracie's first horse show, where we learned they both had a deep love for horses. Now, I would like to say that we met a lot of great nurses and doctors in our time at SMH. Some names I recall, and some, sadly, I do not. They all, in some way or another, played a role in my daughter being here today. With that said, Suzanne is something altogether different. We have friends who have delivered their children at SMH, and many have stories of the nice people, and more than once we've heard Suzanne's name mentioned, so we know she gives great care for everyone. What she did for us goes beyond reason and beyond the rambling description we have tried to give here. With love. She's out of words. Yes. Isn't that amazing?
Beautiful plaque for you, and I'll read it, please. We want this on TV.
Okay.
The hospital board and administrative staff of Sarasota Memorial Healthcare System are grateful to all employees who constantly enhance the quality of a patient's stay by making an extra effort in their daily activities. The Excel program is designed to recognize employees who have distinguished themselves by superior performance and attention to others. Individuals recognized are models of excellence who strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in the community. The hospital board and administrative staff are pleased to present to you, Suzanne, with the Excel Award of February 2014 in recognition of your demonstrated courteous and caring attitude and contributions toward excellence at Sarasota Memorial Healthcare System. Signed by Gwen McKenzie, Chief Executive Officer, and Marguerite Malone, Chairwoman of the Board. Congratulations.
Thank you.
As we sometimes do, we also have a hero award this month, and our hero is Deborah North for February of 2014. I proudly nominate Deborah North for the SMH Hero Award. Deborah represents the true definition of a hero. On the evening of November 13th, 2013, Deb and her husband were attending a charity function at the Hyatt. An announcement was made for a medical professional to attend to a patron. Deb immediately responded without hesitation and began to assess the situation. A female patron had a medical crisis and collapsed at her table. Deb took control of the situation and immediately began administering CPR. Even though there were physicians present, she took the lead and ultimately saved the woman's life. Deb is someone that continues to go above and beyond at work and in the public. Deb is a true asset to the organization and the Sarasota community. I'm proud to have her as part of our cardiopulmonary rehabilitation team. Congratulations.
Deborah North is hereby inducted into the Sarasota Memorial Healthcare System Take Pride Hall of Fame as a hero. or hear of one, on this 18th day of February 2014 for meritorious customer service, including consistently exceeding the expectations of our patients, families, visitors, and staff, being an example to peers and others, having a personal commitment to excellence, going far and above and beyond the individuals in our community. Signed by Gwen McKenzie, Chief Executive Officer, Margaret Malone, Chairman of the Board. Congratulations.
Thank you.
And now the report of the medical staff from our Chief of Staff, Dr. Cindy Von Walder.
Thank you, Mr. Carter. I have only one item of action for the board, and that is the approval of core privileges for vascular and interventional radiology. This has been reviewed and approved by the Medical Executive Committee, which recommends your approval.
Mr. Chairman, I move approval of the core privileges for vascular and interventional radiology as recommended by the Medical Executive Committee.
We have a motion and a second. Comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
That concludes my report. Thank you.
Thank you. Next is the auxiliary report from the President of the Auxiliary, Robert Dutrell.
Thank you, Mr. Chairman. On January 21st and 22nd, the auxiliary hosted the jewelry vendor masquerade. The sale added approximately $1,000 to the auxiliary treasury. On March 18th and 19th, Scrubs and Stuff will return for a uniform sale in rooms 4A and 4B next to the cafeteria. On Tuesday, the sale will be from 6:30 a.m. to 4:30 p.m., and on Wednesday, the sale will be from 6:30 a.m. to 3:30 p.m. They will have all the color-coded scrubs used by the hospital, along with other paraphernalia such as shoes. On the second Tuesday of each month, the auxiliary holds a board meeting, and immediately after, a pin ceremony takes place. The occasion is to honor the volunteers reaching a service goal. The pins start at 100 hours, then 200, then 1,000, and continues in units of 1,000. The largest pin we have ever issued is for 20,000 hours. We toast our pin recipients with champagne, non-alcoholic champagne. It is a pleasure to present pins to these volunteers who happily give so much of their time to serve the needs of the hospital. That concludes my report.
Thank you, Bob. Next is the Sarasota Memorial Healthcare Foundation President, Alex Quarles.
Thank you, Mr. Chair. I do have a much more in-depth report for you today. And if I may also share a letter that I received, which we receive notes occasionally, but this one was very special, which Gwen did hear about at our board meeting, as did Chair Dr. Malone. But first of all, I just wanted to let you know that the grants approved for this first quarter of the year was bronchial thermoplasty for $71,700, research nurse salary for the clinic. Thank you very much. $75,000. Zeiss Pintero microscope, $199,302. The zero gravity radiation shields, $350,000. Replacement ultrasound for endoscopy at $445,116. And the ICU renovation and upgrades, our first component of that is $2.232 million for a total of $3.373 million this first grant round. Upcoming activities, we had a board retreat recently to really look at where we want to go as a foundation in the future and how we want to be perceived in the community so that we can have a much stronger presence. There's an awful lot of competition. When I came here 19 and a half years ago, there were 300 not-for-profits. Now there's over 2,000. So the competition is very high. So we are looking at how we are going to position ourselves in the market down the road. Activities that are coming up, we have a professional advisors network meeting coming up, which is our estate and financial planners and attorneys on April 22nd. We have our Women in Medicine event coming up, which is on February 28th. And just because it's called Women in Medicine, it does not exclude men. I encourage you to be there. Our speakers will be Dr. Jim Schumacher, who is a neurosurgeon and also does research at Harvard Medical School. I remember we funded approximately $1 million between technology and his research to bring him here. Dr. Kirk Volker, Director of Clinical Research, and with a special guest, Dr. Andrew von Eichenbach, who's the chairman of the Manhattan Institute's Project FDA, former commissioner of the U.S. Food and Drug Administration, and former director of the National Cancer Institute at the National Institutes of Health, to talk about why it's so complicated and difficult for drugs and drug trials to be accepted here in the United States as compared to other countries. So I encourage you, there's definitely seats and places available. We've got a number of sponsors, but please feel free to come and listen. We'd very much like to have you here. Dr. Oz will be here on March 28th for about 3.5 hours. We're flying him in from Palm Beach and then flying him right back again. But we have about 1,200 seats to fill, and we're doing pretty good now. I think we're at about 900, so please make your reservations as soon as you can. The Employee Partners in Caring campaign has begun. We have a legacy luncheon coming up for those that have included us in their estate plans on April 9th. As you know, the golf tournament is May 2nd. And on March the 11th, we are sponsors for the Southwest Florida Plan Giving Council. So those are all really, excellent things that we are working towards. This short letter that I want to just share with you tells you a little bit of a story. While the hospital sends us grants for various amounts of money and for projects, what you don't know is how much money we actually spend in sending nursing and other staff to various conferences and conventions and get their certifications. So here's just a short recap since June of last year. And I'm going to say we average about $250,000 a year just in nursing grants towards the hospital. And it says, we would like to take this opportunity to thank the SMH Foundation for its continued financial support of our nursing staff. During the past 6 months, quite a few nurses have been able to attend national conferences. The staff is so thankful for the opportunity to participate in these educational events. In June, 4 of our clinical coordinators attended American Organization of Nursing Executives Emerging Nurse Leaders Conference in Portland, Oregon. They were exposed to the basic budgeting, interviewing techniques, conflict resolution, and team building. Another benefit of attending the conference was their ability to network with the leaders from all over the nation. They were proud to discover that SMH is, quote, miles ahead of the national competition. Also in June, 4 staff members from the hyperbaric department were able to attend the 46th annual scientific meeting of the Undersea and Hyperbaric Medical Society in Orlando. And they were able to hear researchers from all over the world sharing their findings. The topics were all very relevant to their daily practice and said the information was invaluable. In July, 3 employees had an opportunity to attend the first annual STAR Connection program in Cambridge, Massachusetts. This was to provide service line targeted for cancer survivors of all disease sites. They were all inspired with the mission of the survivorship training, and their goal is to launch the first STAR program in this market. In September, 2 nurse directors attended the Emergency Nurses Association National Conference in Nashville, Tennessee. The conference gave them the opportunity to learn about the new and emerging technologies to improve patient care, patient flow, and employee satisfaction. They were also able to network with other healthcare organizations and companies regarding innovations and best practices. Also in September, 3 nurses had the opportunity to participate in the Association of Vascular Access Conference in Tennessee. There are several practice changes planned and procedures modifications are being worked on right now. a preparation course which was offered at the Conference for Certification of Vascular Access, and this nurse recently passed the exam. In October, 7 nurses were excited to attend the ANCC National Magnet Conference in Orlando. The pearls of wisdom gleaned at the conference assisted the nursing survey and ultimately in the magnet redesignation. In November, there was a number of nurses that attended and participated in the Geriatric Nursing Leadership Academy. This nurse was selected as a fellow and the only fellow selected from the state of Florida. The fellowship affords our organization the benefit of national recognition, future funding, and access to resources through the John A. Hartford Foundation. In December, the foundation sponsored to attend a 2013 San Antonio Breast Cancer Symposium. This symposium is regarded as the premier conference for disseminating new research regarding the care of breast cancer. I was able to hear research presented that was directly impact our patients here in the community will be able to be applied immediately. She was also able to blog her experience and wrote several blogs that were published on breast cancer support website that was started here in Sarasota by a young breast cancer survivor. As always, we thank you for your continued support. Attendance at these national nursing conferences is an integral component of being able to provide the community with the best possible nursing care. So those are the things that we don't often talk about, but I thought it was important for you to know that on aside some of these larger conferences and programs that we do like to fund, we do like to touch people one-on-one and allow them to have the opportunity to gain in their careers. So that concludes my report, unless you have any questions. Thank you.
Thank you very much, Alex. Secretary's report. Tom Tower.
Thank you, Mr. Chairman. The board's program for March. The first meeting is on Thursday, the 6th, at 7:30 at the board breakfast, at 8:30 for the Quality Committee, and at 9:30 for the Finance Committee. The next meeting is on Monday, the 17th, at 9:30, at 1 o'clock for the public board meeting. That's my report, Mr. Chairman.
Thank you, Tom. Next is the treasurer's report. Joe DiVirgilio.
I have one action item today. I move approval of the bad debt and charity care for the month ending January 31st, 2014, in the amount of $11,246,000.
Second.
We have a motion and a second. Any questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. Now, operations report. Bill Wolchin, CFO.
Good afternoon. I have the financial highlights for January 2014. For the system, our operating revenue for the month was $48,720,000 compared to a forecast of $48,014,000. For our fiscal year to date, and this is through 4 months of our fiscal year, operating revenue of $181,923,000 compared to a forecast of $179,249,000. The system total expenses for the month, $47,790,000 compared to a forecast of $48,010,000. For the fiscal year to date, total expenses of $182,932,000 compared to a forecast of $181,808,000. Our operating income for the system in the rating agency format for the month of January, $3,488,000, which was an operating margin percent of 6.7%, compared to a forecast of $2,334,000, or an operating margin of 4.5%. For the 4 months of this fiscal year, our operating income stands at $8,656,000 for an operating margin of 4.4%, compared to a forecast of $6,726,000, and that would be an operating margin of 3.5%. The hospital's paid hours per adjusted admission for January we're 118, and for our year-to-date, we're at 125. Operating statistics for the 4 months in this fiscal year 2014 for the hospital, our average daily occupancy, 387, of which 37 were observation patients, against a forecast of 366, and we forecast 42 observation patients. Admissions, so far this fiscal year, we have 9,577, compared to a forecast of 8,624. Our average length of stay is 4.49 so far this fiscal year. Surgery cases through the 4 months of the fiscal year, 6,503, compared to a forecast of 6,645. Births stand at 1,031, compared to a forecast of 933. The hospital's outpatient registrations, again for 4 months of the fiscal year, 134,308, compared to a forecast of 140,361. Emergency care center registrations, 36,042, compared to a forecast of 33,381. Our case mix index so far this fiscal year for all patients stands at 1.63, and for Medicare patients, 1.76. Mr. Chairman, that concludes my report unless there's any questions.
Any questions for Bill? Okay. Thank you, Bill. Now, David Verinder, our Chief Operating Officer.
Thank you, Mr. Chairman. I'm going to start today just by talking about our Bee Ridge facility that's going to open this April 1st. We'll have a grand opening on April 16th at 5:30, so we invite anyone in the public and certainly everyone here to attend that. The project's coming, obviously what you see here is not a live picture, it's the artist rendering. But when we flip to the next page, we do see what's going on there, and I'd invite you just to drive by the location on Bee Ridge and take a look. It's coming along very well. The interior is mostly pretty much formed up and is getting the finishing products put on right now. And so I think the whole property is going to be a big asset for this community in Sarasota. The next I'm going to go through a bunch of construction projects here, Mr. Chairman. The next one is you may have all passed on the way in here by the smell of paint and glue and everything else that was coming out of that room, but is in the Cypress room right across the hall here. The completion of the interior finish work in the room with flooring, paint, and blinds and video projection. This is the last of our Waldemere Medical Plaza conference rooms that is going to be completed in this project, and the work should be done within the next 2 weeks. Next project, just to take a look at, is one that the board approved several months ago. It's our radiology interventional reading room. It was constructed in conjunction with the replacement of the interventional room number 1. That allows physicians a quiet area for viewing. Work was coordinated with and took into consideration of the upcoming interventional project number 2 that was also approved. So I will give you the feedback from our radiologists, as Gwen even shared some with me this morning, that they're very happy with the images that are coming out of it and the workspace, and it's really top notch. So I think that was, I think, from Dr. Lee. Is that right, Gwen? So very, very happy about this, and you can see what doors look like, I suppose, in that picture. Looking on, we have the East Tower corridor that this is under construction now, looking towards the critical care tower. Just to let you know what we're doing there is we're putting new flooring in, paint, handrails, lights, and ceiling tiles. To the right of that, what you see is the interior of an East Tower patient rooms that is also receiving new flooring, paint, casework, lighting, televisions, and ceiling tiles. So it will get that to as close to a brand-new looking facility as we can get there, and I think it'll really increase the patient satisfaction on those floors. Next picture is of our critical care tower roof. We started the resealing of the membrane roofs on the critical care tower. New coating for roofs adds another 10-plus years to the warranty and extends the life of the roof for the same amount of time. This is considerably less intrusive and expensive than a full roof replacement, so we had a couple glitches on that, should be done with that in the next day or two. I don't have a picture of this next one, but as anyone who has noticed, if you look at the south garage, we have our pedestrian bridge work going in place that's going to connect Medical Arts building with our south garage. The pedestrian bridge footings are poured and are in place, and you can see those if you drive or walk by there. The preparation work on the garage and in the Medical Arts building to receive the bridge connection is starting this week, so it's ongoing this week. The steel columns to support the bridge are scheduled for this week. And the bridge itself, which is of course being built off-site and will be brought in, is scheduled to arrive, and it will have a police escort to arrive here, and we'll coordinate that with our security team. But the week of March 4th, weather pending. So we'll finally have that connected, and everyone will be happy and relieved, I'm sure. Final moves, just wanted to hit a couple of the different final moves that you're going to see going on if you're in and around the hospital. The ECC Associates offices that are on the 3 East Tower are moving this week, and their space is in final completion stage. Where their offices are right now will be demolished in that same day or right afterwards, and that's where we'll start the new medical office, medical staff offices that are going to move upstairs. We should have the medical staff offices completed by March 31st and staff occupying right after Doctor's Day of April 3rd. So that'll be right up by the physicians' facilities on the 3rd floor. Kind of moving out of construction into pain care, this past weekend, we led by Dr. Raphael Miguel and Carolyn Michael, who is our director of the SMH Pain Medicine Program. We had the 10th Annual Pain Symposium at Lido Beach Resort this past Saturday and Sunday. Over 300 attendees from across the nation, and these include physicians, nurses, nurse practitioners, physician's assistants. We offered everyone there 15 hours of CME that were included in it, and I think it's just a great project and a great thing that we've supported for a number of years, along with the foundation. And Alex, we really thank you for your support in that. And it really brings to light what goes on in the world of pain care. Moving on to First Physicians Group, a couple different announcements there. I first want to recognize Dr. Alan King, who is one of our med-ped physicians that practices out of the Blackburn Point location in Osprey. Dr. King received the Reader's Choice Award for Best Pediatrician for Venice from the Sarasota Herald Tribune, so please congratulate Dr. King when you see him. We also received notification that 2 of our 3 practices, Lakeside, which is in Venice, and AIM, have received recognition as Level 3 patient-centered medical home. Special thanks to Courtney, our Director of Clinical Services, for her hard work and dedication in moving this project forward in very little time. And we hope to have a lot more of those centers announced that we are continuing to bring on our offices to that designation. And then finally, in First Physicians Group, I just think it is good to recognize that this is our 20th year anniversary of First Physicians Group. And some of you probably can't believe it's been 20 years. I was not here when it started, but it's been amazing to watch it grow from just a couple of small practices to really a full-fledged largest group in town. So I just wanted to give you a couple of the facts of what the group has. We have number of providers now. We're at 113, which includes primary care, OBGYN, dermatology, cardiovascular surgeons, hospitalists, psychiatrists, and maternal fetal medicine physicians. We have 18 practice sites spread from everywhere from Manatee County to as far south as Northport and Venice. We have over 225 employees there, not counting the providers themselves. So have quite a bit of employees in there. Over 300,000 annual visits to all those physicians, and within that group do over 14,000 surgeries a year. And number of procedures in 2013, 420,000. So it's grown into quite a mature, it's not a mature little group anymore, it's a mature large group and very successful and something the community to be proud of. And then finally, just in the public safety security world, additional security cameras are being installed at all the SMH urgent care centers in response to staff concerns and some risk assessment issues. These cameras will provide additional security and function as a force multiplier for our public safety department. This project is scheduled for implementation first week of March, and right now we have over 500 cameras spanning all of our facilities from as far north as, once again, as Manatee County, Highway 64, all the way down to Venice and to Northport. And that's my report.
Any questions for David? Not. Thank you. We have no board reports, so next will be committee reports. We'll start with the Governance Effectiveness Committee. Alex Miller.
Thank you, Mr. Carter. The Governance Effectiveness Committee met on February 4th, and there are 4 topics of interest. The first being that several board members and a few from administration attended the Governance Institute conference in Naples and listened to several presentations on the financial and structural changes in healthcare. Next up was a discussion on the Baycare relationship and agreement. Steve Mason, Baycare CEO, joined the meeting to recap the first completed year of the management services agreement. We reviewed the issues in healthcare, such as decreases in reimbursement and the changing business model that led to the decision to affiliate with a larger organization, but to remain autonomous. We then reviewed the outline of the board's authority with respect to the agreement. Steve Mason reviewed the philosophy of the affiliation and requested the committee's feedback on the first year's performance and outcomes. The members shared their thoughts. There was general agreement that the relationship had progressed appropriately during the first year, but there is need for further data to adequately evaluate current and future initiatives. There was also consensus that the relationship should be monitored carefully to assure that Sarasota Memorial's goals and objectives remain at the forefront. Then we discussed board self-assessment survey. The results of the annual self-assessment again demonstrated that the board performs at a very high level in comparison to other public healthcare boards included in the Governance Institute survey. Finally, we have a policy review. The committee reviewed and recommended approval of a revised transparency policy that affirms the board's commitment to a meaningful public reporting in the areas of financial data, quality safety measurement, and patient experience data. And I have a motion. I move approval of the board policy on transparency, policy number 710, BD 12, as recommended by the Governance Effectiveness Committee.
Second.
We have a motion and a second. Any questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
And that completes my report.
Thank you, Alex. Human Resources Committee. Dick Donegan.
Thank you, Mr. Chairman. The Human Resources Committee met on February 4th. Susan Curran reviewed the annual Human Resources Employee Competence Report. The purpose of that report is to ensure that the hospital has developed a comprehensive approach to ensuring a competent workforce. The report includes the following components: the purpose of the competency report, performance management and competency assessment, a summary of contract personnel, and summary of employee counseling and education initiatives in both the clinical and non-clinical disciplines. Susan also discussed the SMART plan and the performance appraisal rollout, traveler competency assessment statistics, mobile float pool, disciplinary actions, and non-clinical educational initiatives. Lisa Baumgartner then discussed the numerous clinical educational initiatives. These include safety simulation, team steps, ANCC approved provider continuing education, career edge finders, collaborative higher education and tuition reimbursement, clinical collaboratives with USF, orthopedic cross-training, inpatient oncology medical surgical unit and day treatment center, nursing internships, acute pain service, wound care programs, geriatrics, research and evidence-based practice, nursing orientation, and charge nurse workshops. It's clear that we have excellent programs both for training and appraising and educating the staff here at Sarasota Memorial, which is one of the reasons this hospital ranks so high. That's the end of my report.
Thank you, Mr. Donegan. Next, we have the Investment Committee report. Joe DiVirgilio.
Thank you, Mr. Carter. The Investment Committee met on February 4th and continued the meeting this morning, February 18th. We received presentations from Summit Strategies Group, our investment advisor, regarding their analysis of the fund managers for each of our asset classes. Additionally, the committee discussed actions regarding a bond which no longer meets our investment policy. Based on the committee's work, I'd like to make two motions this afternoon. First, I move approval of the retention of the bond asset that no longer meets the investment policy criteria in the intermediate portfolio of the board-designated funds until such time as it can be sold without a loss, as recommended by the Investment Committee.
We have a motion and a second. Any questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
I have a second motion. I move approval of the investment managers for the SMH Healthcare Retirement Plan in the investment areas of public bank loans, emerging market debt, master limited partnerships, private core real estate, hedge funds, U.S. large and small cap equity, international large and small cap equity, emerging markets equity, and fixed income, as more particularly set forth in the chart that will be attached to the copy of these minutes and as recommended by the Investment Committee, and to authorize administration and those managers to take action consistent with this approval and the rebalancing of the retirement plan assets previously approved by the board.
We have a motion and a second. All questions? All those in favor, please indicate by saying yes.
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 Opposed? Motion passes. Thank you.
That completes my report.
Thank you, Joe. Next is the Mission and Planning Committee, and I'd like to temporarily turn the gavel over to Alex Miller so that I can give the Mission and Planning Committee report.
Thank you, Mr. Carter. Please enlighten us.
The Mission and Planning Committee met on Thursday, February the 6th. We started out with a presentation on interventional radiology, and David Verinder introduced Dr. Dan Case, the neurointerventional radiology, and Deb Bohannon, Director of Radiology, reported on the limitations of the current interventional radiology suite and discussed the due diligence conducted on the types of equipment. The interventional radiology physicians who will use this equipment were introduced. Then Dr. Case discussed repairs, stroke blockages, aneurysms, tumor embolisms, and the procedures are very sensitive to complications. The goal is to limit complications as much as possible. The need for a biplane equipment with less exposure to radiation will improve patient outcomes. This equipment has the highest resolution, and it is the best practice. The current system does not have this capability. Dr. Case reviewed several slides of aneurysms and showed that the newer systems have more capability. Benefits of the new interventional suite were discussed by Deb Bohannon. And at this time, I move approval of the interventional radiology equipment as presented to the Mission and Planning Committee for a project cost not to exceed $2 million as recommended by the Mission and Planning Committee.
Second.
All those in favor of the motion indicate by saying yes.
Yes.
Any opposed? Motion carries.
Next, we had the inpatient rehab facility. And David introduced the team, and they're very excited about the project, which is, as they say, long overdue. Maria DiCarlo discussed the rehab facility, which opened in 1988 in the East Tower on the 10th floor. In '05, SMH added 10 beds on the 9th floor of the East Tower, and SMH is the only hospital-based rehab facility in Sarasota County. Maria discussed inpatient rehab facility regulations, inpatient rehab diagnostic categories, inpatient rehab facility regulations and payment systems, DRGs versus CMG, and SMH's continuum of care includes acute care rehab, post-acute care, outpatient rehab, home care, and nursing and rehab care. She then continued to discuss the service line pro forma, and payment reform, market assessment, patient origin, out mitigation of inpatients for inpatient rehab for the surrounding counties, our market, and the CON batching cycle for 2013. Tom Perigo then discussed the campus improvement plan for the inpatient rehab center. He discussed the interlocal agreement with the city and showed a site plan that was submitted to the city in 2009. He reviewed the building floor by floor, and he provided a diagram of the proposed buildings. And there was good discussion relative to Doctor's Gardens and the plan for future campus improvements. He then showed a building rendering, and everyone was in favor of the rehab hospital space. And it will be brought back to the April Mission and Planning Committee. The pharmaceutical information systems was next. Dennis Baker, Chief Information Officer, updated the group on the information systems currently underway. And at this time, I recommend approval of an additional $500,000 to complete the pharmacy information system project as recommended by the Mission and Planning Committee.
Second.
All those in favor of the motion indicate by saying yes.
Yes.
Any opposed? Motion passes.
The next was, and last item, was the selection committee, and Tom Perigo reviewed the selection committee for work at 1852 Hillview. This is the renovation of that building, and the contractors that were chosen in order, first was McIntyre, Ewell, and Strammer, general contractor. Second was Willis Smith Construction, and third was DeAngelis Diamond Healthcare Group. And I approved the rankings of the general contractors for the renovation of 1852 Hillview Street as follows. McIntyre, Ewell, Strammer, general contractors first, Willis Smith Construction second, and DeAngelis third.
Second.
All those in favor of the motion indicate by saying yes.
Yes.
Any opposed? Motion passes.
Thank you. Lastly, was the architects and engineers for that project. They ranked Carlson Studio, LGA Architects, and Harvard Jolly Architecture. I move approval of the rankings of the architects and engineers for the renovation of 1852 Hillview Street as follows. Carlson Studio, Plunkett Rasich first, LGA Architects, Inc. second, and Harvard Jolly Architecture.
Second.
All those in favor of the motion indicate by saying yes.
Yes.
Any opposed? Motion carries.
And that concludes my report. Thank you, Alex.
Thank you, Mr. Carter.
Next is the Quality Committee report. Bob Strasser.
Thank you, Mr. Chairman. As you know, the Quality Committee meeting was held on February the 6th. But since the quality meetings are held in a closed session, I have nothing to report other than one item which needs attention. And that is that the committee recommended that the Quality Committee presented a plan for the provision of patient care. And I would like to move approval of the plan for the provision of patient care as recommended by the Quality Committee.
We have a motion and a second. Any questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
That's all.
That's all you have. Good. And we have our president's report. Gwen McKenzie, our president and CEO.
Thank you, Mr. Chairman. This is our 2014 year-to-date leader report card in the pillars that you're very familiar with, so I'll go through those in a little detail and for the community. In the patient experience area, the service pillar, our HCAPS, our goal is 9 domains of questions above the 50th percentile for the Centers for Medicare and Medicaid, and we're currently at 7 year-to-date. Very pleased about that. On the outpatient side, with 850,000 outpatient registrations, we set our goal to be at 83% of the Press-Ganey patient experience measure. We're currently at 80. In the people pillar, we're getting ready to do the Gallup employee survey, so we'll be doing that sometime in late April or May. So that has a score of to be determined. The goal is to exceed the score of our last survey, which was 4.26 out of a goal of 5. We had 90-some% participation in that survey. The merits on time is a joint commission requirement. It's required that 95% of our employees have their evaluations on time. Currently, we're at 99%. In the quality pillar, value-based purchasing is the Center for Medicare and Medicaid system of reimbursement based on quality outcomes. And our goal is to be at the 100% measure. We're currently at 99.8%. The organization percent of patient safety readiness is our monthly rounding and interviewing and auditing to ensure that we're ready for any survey anytime, but more importantly, we stand for patient safety every day. And our goal there is to be above 95% in all the areas surveyed, and we're above 99. Infection prevention is a combination overall standardized infection rate for 3 important areas. One is central line infections, another is catheter-associated urinary tract infections, and the third is standardized surgical infection. And we're currently just a little bit over our goal of 1.0, but you saw evidence earlier that we're making strides in that area. The finance pillar Bill reported on year-to-date, we're at 4.5% positive operating margin. Our goal is our budget of 4.2%. The growth pillar, I'm pleased to say, for the first time in many years, we're substantially exceeding our inpatient admission goal. It's a little above 25,000, and we're a little above 26,000. And then finally, in outpatient registrations, our goal is 812,000, and we're just a little over 800,000. Now to show you a little more detail, this is we call it HCAPS, which is our patient experience, the Hospital Consumer Assessment of Healthcare Providers and Systems. We've got some new data for you here today, but this is our month-by-month patient experience score, and as I just said, our goal is to be 9 of 10. You can see in January of 14, we were 8 of 10, which was really outstanding because each of these domains averages increases about every 2 to 3 months because everyone in the country is doing the very same thing we are, trying to have a perfect patient experience. But we were very pleased with January's results. Year to date, here's where we are. We don't have the quarter results yet since January is the first month of the quarter, but October through December, we were 7 out of 10 on average, and you can see the areas that we're continuing to work on. These are our regional area hospitals who are doing the same thing that we're doing, and you can see how we compare with the other hospitals in our region. You can see we're doing quite well. Then, this is our real goal and who we really view our competitors to be. These are nationally recognized hospitals, starting with Mass General and finishing with Baylor, with everything in between, Duke, Cleveland Clinic, Brigham and Women's. And you can see that, you know, the great organizations around the country are doing as well as we're doing, which I think indicates it can be done, and we will be focused on this. The Cleveland Clinic is quite impressive at 9 domains, which is our goal, so we know that can be done. On the outpatient side, this is the likelihood of recommending, and this is how we have done October through January. As I mentioned, our overall average is at the 80th percentile. Our goal is at the 83rd percentile, so we've got some work to do, but overall making great progress. Our people are always asked to be judges and in the Sarasota County Science, Engineering, and Technology Fair, so this is just a few of the judges. They have a great time doing it, and they're wildly sought after for that purpose. Our Health Square, I think Peter has indicated in some of his reports to you that we're over 40,000 encounters. Thank you, Alex, for the foundation funding that initial startup. It's really turned out to be a great relationship builder with our community. This is just one of the activities that they're holding down in the Central Sarasota Square Mall right now. It's a Power Up Families Walking program, and you can see all the people there. They do a little presentation, and then they do their power walking, and they've got over 100 people who attend and walk and signed up. Then this was a first for us and a first for the community. The Institute for the Ages was very fortunate to be chosen to hold the International Conference on Positive Aging. This has previously been held in California for quite a few years, but Sarasota, because of the Institute for the Ages, was selected to hold the conference this year. And we were selected to be one of the community participants. So on one of the days of the conference, we actually had these esteemed speakers, including our own Dr. Volker, who heads our clinical research center, sitting in the surgical area of our main lobby and talking about translational research and translational design thinking. It was really very interesting how people are thinking about reaching people through the design of organizations like ours. Then this is our value-based purchasing clinical process of care measures, which we also refer to as core measures, and you can see that we're doing quite well way over there in October. That's the most recently reported month to the Centers for Medicare and Medicaid, and you can see that we're hitting in almost every area with the exception of heart failure discharge instructions, where we missed one patient. Dennis Gondolier reported on our rank in Becker's Hospital Review as the 100 hospitals with great women's health programs in 2013, so we were very pleased about that. Talked about our own Dr. King and his selection by the Reader's Choice in Venice as the best local pediatrician. We're really pleased that 2 of our nurses have been selected for this world convention for their work and they're going to Portugal. They're quite excited about that. They'll be sharing the information about the alarm management project, which was between the NICU and labor and delivery, and all the systems that connected the key system of notifying the NICU that there's a unstable infant coming from labor and delivery, and they timed this down to the seconds. So it was really wonderful that they were selected, and they're very excited about it. And that concludes my report.
Any questions for Gwen? Thank you, Gwen. Consent agenda. I don't think we have any items on that. Public comments, Donna? No public comments. Legal matters. Our counsel, Carol Ann Kalish.
I have nothing to report.
Okay. Do we have any other business? If not, we are adjourned. Thank you very much.